Thank you very much. Am I audible? So I just wanted to take you through a quick presentation on, virtual interventions. It's about, a little bit about the background on virtual interventions, and then we dive in through what WHO and UNAIDS recommend as, approaches for virtual interventions, or there's a policy brief that we've launched, which I will be taking you through today. So, just as a background, where we started, I want to take you all back a few years by, say, 5 or 6 years when we actually started thinking about virtual interventions, right? We were all implementing HIV programs the traditional way, and we were seeing a lot of gap in the first 90. At that time, it used to be the 90-90-90. And we were seeing a huge gap as far as the 90 was concerned. So, we were thinking, where are we missing the populations? Where is it that we need to look for populations? And I think that's when we, as a team, all of us thought that why not try the social media? Why not try to reach people on social media and see if there are new populations, never tested, younger populations that we can find on social media or dating apps? And that's how the whole thing of virtual intervention started 5 or 6 years ago. And, we wanted to reach out to people where they were. I think people had stopped being in physical spaces. They were more in the virtual spaces, and that's where we wanted to be with them. I think there is a lot of countries thereafter started implementing virtual interventions, especially during COVID time, because they wanted to mitigate the impact that COVID had on HIV programs. But a lot of programs lacked structure. There were ad hoc approaches that were being used, and there was no monitoring or evaluation that was being done for any of the interventions that were being carried out. And I think, countries were demanding for technical assistance on virtual interventions as they wanted to implement or scale up in their respective countries. So, just again, why do populations not access services? Why do we miss out on a large chunk of population? I think it's because of, first of all, lack of information and awareness. We have a lot of non-identifying populations. Like, by non-identifying, I mean populations who do not identify themselves as key populations, but are vulnerable and in need of services. So they also believe that they do not have a risk behavior. They are probably having sexual encounters with known people, and therefore there's no risk. Stigma and discrimination still is the big elephant in the room. We still haven't really tackled it very well. And we also have, we also lack access to services, especially for these non-identifying populations. Also, lack of confidentiality pushes people back from going into a facility and, asking for services. So what are virtual interventions? We wanted to reach hard-to-reach populations, these non-identifying populations. We wanted, to kind of give an option, a self-care option to individuals that were seeking services without having to go face-to-face at a facility. And therefore, any approach or strategy used virtually, whether it is over a phone call or over the internet, can be termed as virtual interventions. This could be telehealth, it could be data-related or data-driven digital interventions, it could be just a simple ordering of a self-test kit at home or a doctor consultation. And with COVID, I think we've already learned being virtual. And so, I think it's only fair to provide that extra option for a person to go virtual and access services. So last year, in 2022, at the IIS in Montreal, we launched the policy brief on virtual interventions in response to HIV, hepatitis, and STI program. This was jointly done by UNAIDS and WHO. And it includes a lot of information about virtual interventions, because I think countries were struggling with what exactly can we call as virtual interventions? What are the kind of approaches that can be termed? How do we really monitor it? I think this policy brief was meant for countries who wanted to implement or scale up virtual interventions. And it has a whole lot of, examples. We have, frameworks. We have some approaches. We have, a lot of, safety and security considerations that have also been mentioned in the guideline, which will actually guide a program to plan, design, and implement virtual interventions. A lot of times I get asked this question, we've been implementing HIV programs for many, many years. Why do we need to go virtual, and who do we really reach virtually? Who is our target audience? And I feel that, it's everybody, anybody and everybody who wants to be reached virtually or has access to a phone, not necessarily internet, but a phone, can be reached through virtual interventions. And I think, it could be a combination of different things that we are already doing. Like all the populations that we reach should be given all options. Like, do you want to go to a facility or do you want to be reached virtually? There's an example of an implementation framework that we have given because we want virtual interventions to be used across the cascade and not just for prevention. So virtual interventions needs to link the person across the cascade through prevention, testing, and treatment. And all of the approaches that we would normally do in the physical world can be done virtually through many, many different strategies and approaches. Now, why was this, like I mentioned, there were countries that were struggling with how do you scale up virtual interventions? How do you implement them? Do you have any policies? Do you have any safety policies? What about training for our outreach workers? They don't know how to start a communication on a chat or on a phone call. They've always been used to face-to-face interventions. And I think this policy brief would actually give you an inside view of how do you do all of that and then much more. We also wanted to help the government to understand the importance of integrating virtual interventions into their national HIV programs, because I think that so far in the past few years, virtual interventions has proven to be successful, but almost remained like a parallel program. But here we need to understand that we are not here to replace what is already being happening or the physical program, but we need to supplement what is being happening. So we need the physical and the virtual program going side by side, or together rather, so as to reach populations, the unreached populations, and also reach them with the services that they want and the way they want. So this policy brief can be used by community organizations, by NGOs, by national health programs, and by private and public facilities also who would want to go digital with their programs. I just wanted to give a quick example of how virtual interventions or, how we can use virtual interventions for HIV service delivery. And this is an example from Vietnam, where we, there's a HIV self-testing delivery that's happening virtually. So there's a web app that has been created by PATH, and this was basically you can get online, you get a risk assessment done, you order a self-test kit online, you get it delivered at your home through Grab or any other food delivery app. You report your result, and you can also start PrEP after this. So self-testing for PrEP is also something that WHO now recommends, and we've started that virtually as well. Thank you very much, and I'll be open for questions later. Thank you.